Okay. Well, welcome everyone to today's webinar on client self-advocacy for transportation and mobility professionals. My name is Liz Taylor. I'm the Assistant Director at National RTAP. And before we get started, I'm going to go through a few brief introductory slides. So if you're not familiar with National RTAP or the National Rural Transit Assistance Program, we're a technical assistance center funded by FTA, the Federal Transit Administration, through their Section 5311 formula program for rural areas. We provide no-cost training and technical assistance resources and services, which I'll describe in the next slide. And with only a few exceptions, our materials can be used by anyone, but they are targeted toward rural and tribal transit agencies and state programs and their state transit programs working with the rural providers. We're guided by a 14-member review board made up of State Department of Transportation staff and transit providers, usually transit managers. And we are actually soliciting for new board members, and that's on our website on our news page, and that will close in early 2024, and we use that solicitation to fill vacancies for the next few years. So if you're interested, check that out. We are based in Massachusetts. I'm outside of Boston, and we also have an office in Washington, D.C., and you can learn all about us at nationalrtap.org. So this is an overview of the resources that we offer. We are well known for our training materials, both hard copy formats and e-learning, and also webinars such as this one. We provide information in various formats like technical briefs, articles, our e-newsletter, which came out today, online toolkits, and topic guides. Different technology tools to help with complying with procurement rules, allocating costs. We provide a website building platform, and we also have a tool that helps put your route and schedule information into a GTFS format for online trip planners. We have peer networking through roundtables, conferences, and online forums. And you could hear what other agencies are doing and trainings they're providing and developing, such as this one. And we provide assistance, so that might just be asking us a simple question or a more complex question, or something where we connect you with your peers or another subject matter expert to get help. So always reach out if you have a question and don't know where to turn. And I am excited today to present our two presenters. So in 2021, we had a grant program, which was, as of right now, a one-time program where we provided grants to 19 projects that were selected to develop, to either develop or grow transportation partnerships that would support social determinants of health in their rural or tribal community. And the Rural Health Network of South Central New York was one of our grantees, and their project was to create different volunteer transportation hubs in their area of New York State. And one of the outcomes of their project was this training and another training that they will they've been using and will continue to use for their volunteer drivers and for their mobility managers, so that they can perform a better service. And we presented it during one of our roundtables, and everyone was really excited about it. So we wanted to make the materials that they developed available to anyone. So that is why we are here today. We did have a one prior session in August on rural cultural competence, and that the webinar recording is on our website along with the slides, and this one will be also. So thank you all for joining, and thank you to Wendy and Emma for presenting today. And they're going to do a brief introduction of themselves before getting into the content. So turning it over to you both.
Hello. Welcome, everyone, and thank you for joining us. My name is Emma Nalen, and I am the Assistant Director for Community Health here at the Rural Health Network of South Central New York. We are a non-clinical not-for-profit, and our mission is to advance the health and well-being of rural people and communities. So we are joining you today from Binghamton, New York. We're in the southern tier of upstate New York, right along the border with Pennsylvania. And just to give you a little bit of information about our agency, so in addition to offering professional development training like this one, Rural Health Network also does direct service. So we meet the needs of our clients through mobility managers, community health workers, in some cases volunteers. We administer a regional AmeriCorps national service program, and we are also heavily involved in local food systems work, including farm to school, produce prescription, things like that. So as Liz mentioned, we were a grantee of National RTAP's Community Rides program in 2021, and we're very happy to be bringing you this training today. Wendy, would you like to introduce yourself before we dive in?
Sure. My name is Wendy Hitchcock. I am the coordinator for community health education here at Rural Health Network of South Central New York. Thank you for having me. This particular training is very near and dear to my heart, so I'm honored to be co-presenting with Emma on this.
Great. Liz, can we go to the next slide, please? So here are our learning objectives for today's session. We are going to talk about what self-advocacy is, how it can improve a situation that you or your clients find yourself in. We will talk about 4 self-advocacy core skills. We will practice some strategies for supporting our clients, and we will practice developing an action plan. Today, we're going to focus on how you can support your riders, clients, or service recipients in advocating for themselves. But keep in mind as we go through the training that these are good skills for anyone, and you can apply them to your own life as well. Next slide, please. So all of us are self-advocates in some way. So if you have ever spoken up for what you believe in, taken responsibility for your life, questioned other people's expectations of you, or even joined an advocacy group, you are a self-advocate. And the purpose of this training is to learn some skills to help you both model and teach self-advocacy to the people you are working with on a daily basis. Next slide. So the concept of self-advocacy gained traction during the civil rights movements of the 60s and 70s. It's currently used and began as a term that disability activists use to emphasize the rights of people with disabilities to make decisions, to live in community, and to access equal employment and education. So we acknowledge those sort of activist origins of this concept. And we also recognize that self-advocacy is valuable to anyone who has to interact with an institution, with bureaucracy, or with really any other person who has the power to constrain their choices. So the sticky note in the corner of the slide kind of summarizes self-advocacy in a nutshell: knowing yourself, knowing what you need, and knowing how to get it. When we initially created this training, we discussed a wide variety of different populations that we work with who could benefit from self-advocacy training. So we talked about using this training with people who seek public benefits, people involved with the justice system, employees working with their employers, parents working with schools or child protective, rural individuals, of course, older individuals, and of course, people with limited access to transportation. Next slide. So as you are all probably familiar with through your daily work, people have transportation concerns for a number of reasons. So they may have a disability or a condition that means that they are unable to drive. Maybe they lack a reliable vehicle. There may be no public transportation if they live in a remote area, or they may not be aware of what transportation resources are available. So regardless of the why, not having transportation becomes a huge factor in how people manage their health and well-being. So to put that in sort of self-advocacy language, transportation becomes the constraint on their choices. Transportation self-advocacy refers to the many ways that we can support our riders and clients in understanding what are often very complicated systems involved with getting transportation assistance. So making sure they're asking the necessary questions, requesting adjustments to their plan as they need, and learning how to find available resources. So I've sort of put the bottom line of this presentation in green here, which is the role of mobility managers and transportation professionals is to support the people that we serve in advocating for themselves to have their transportation needs met. Next slide. Okay, so what are the advantages? Here are some of the ways that learning a few self-advocacy skills can help your clients. Self-advocacy allows people to have more control over their own decisions. It can help in building self-confidence and self-respect. You can learn how to enlist allies to whatever it is you are advocating for, experiencing teamwork with those allies. So in this case, you as a mobility management professional might be one of those allies. Learning how to properly express their own needs to achieve their own goals. And of course, developing conflict resolution and creative problem-solving skills, which can be helpful in many arenas of a person's life. Next slide. So as a mobility manager or a transportation professional, you are often the go-between for clients and various service providers. And we've listed a bunch of providers. We're going to use the term provider a lot throughout this presentation, and this is sort of who we're talking about. So either directly or indirectly, you are helping people manage their relationship with these providers by providing them with transportation, advice, etc. So a lot of our examples today are going to focus on the healthcare system, but those same skills can be applied with social service providers, schools, and other similar situations. Here at Rural Health Network, we developed this training in part based on feedback from our own mobility managers who found themselves often on the phone. So they were advocating on behalf of clients with doctor's office, with the doctor's office, with various public benefits providers, et cetera, trying to get forms submitted, trying to reschedule appointments to a time when the client's transportation was available. Just a lot of logistical issues that were just not on the radar of office staff. And we saw many breakdowns in communication between the clients and their providers. Next slide, please. Okay, so we are going to brainstorm a little bit. If you could either come off of mute or put in the chat what you think are some barriers that might prevent someone from being able to advocate for themselves.
I would say never have had the opportunity to advocate.
Very good. I'm seeing disability and visual issues in the chat. Any other ideas?
Dementia.
What else? What other reasons do you think someone might not be able to advocate for themselves? Language barrier, that's a good one. Unsure of the process and who to contact. Maybe someone doesn't speak the same language or use the correct terminology. Yeah, these are great. Okay. And lack of experience of choice. So someone else makes the decisions for them, right? Okay, Liz, do you want to click one more time? And I think the rest of the bullets will come up. Perfect. Okay, so here are some of the barriers that we have seen. So a lack of support and education. So if people, and that sort of goes along with the second bullet, which is lack of access to information on self-advocacy and self-determination. So if you don't know how to advocate for yourself or what you are advocating for, if you don't have support from the people around you, it's going to be really hard to even take that first step of advocating for yourself. Similarly, lack of opportunities to exercise choice or take risks, that came up in the chat. Low expectations of an individual's capacity to know what is best for themselves, as well as societal attitudes that marginalize or devalue individuals, such as bias or judgment. So the lack of opportunities to exercise choice, I just want to highlight. This can be lack of opportunities in one's own life to make choices, but also lack of opportunities in the community, lack of options. So in rural communities, we see, a lack of transportation options in many cases, or a lack of ways to pay for transportation or even providers to go to. So it can be hard to advocate for a good solution for yourself if you can't visualize or if a good solution doesn't exist in the community that you're in. Also, the societal attitudes or stigma, so that can make it very difficult for someone to learn and to put self-advocacy into practice. So if someone is constantly being dismissed, being told that they are wrong, being treated poorly, it can start to feel like, everyone else is right. And it can be hard to stick up for yourself when that doesn't even feel like an option. Okay, next slide, please. All right, so you may be familiar with statistics about discrimination and bias in the healthcare system. Many people experience discrimination due to factors like race, gender, their age, their weight, their insurance status, whether they use substances, whether they have a disability. There are a lot of reasons why someone might face discrimination in the healthcare system. And we know that discrimination occurs in the doctor's office and leads to unequal health outcomes between different groups of people. We also know that discrimination happens in other professional settings that our clients may be interacting with. So again, that's not just a healthcare problem, it's sort of an everywhere problem. So while preventing discrimination and bias is not the responsibility of the person who is being discriminated against, self-advocacy can be an important skill to practice so that that person can respond when they experience discrimination. So the statistic that I have here on the slide is that there was a study through the University of Michigan that found that 21% of non-institutionalized English-speaking US adults have experienced discrimination while seeking medical care. So again, self-advocacy is one of those skills that people can learn so that they can respond when they experience discrimination. That's not going to solve the problem of discrimination, but it is going to help people exist in the systems that they have to exist in. Okay, next slide, please. Communication errors are a huge barrier to getting the results that we want when we go to see a provider. So there's a lot of reasons why communication might break down between a patient or a client and a provider. So for instance, that person might lack self-confidence or experience. There might be a fear of having open dialogue, limited appointment time. So sometimes appointments will feel rushed, and whether or not the appointment is actually cut short, or if they just feel rushed, it can still be difficult to feel like you're addressing everything you wanted to address in that appointment. We talked about technical jargon, so not using the same words that the provider is used to hearing, or vice versa. Maybe being embarrassed, or maybe there's a breakdown in the way that information is shared between providers. Providers might, so the client might feel that the provider is too important or too busy to listen to them. And on the other side, providers might be very busy and they might ignore or minimize concerns that they don't have time to deal with. So these are all sort of feeding into those barriers of things that might cause someone not to be able to advocate. But these are also scenarios in which it is very important to advocate for oneself. So I am going to turn it over to my colleague Wendy to talk through the first of the 4 core self-advocacy skills that we are going to cover today.
Okay, next slide, please. All right, so there's 4, as Emma said, there's 4 core self-advocacy skills that we're going to talk about today. These are skills that can be taught to anybody. They can come into play in any situation, any of the ones we mentioned, even our day-to-day stuff. So the first one is self-awareness. I'm going to talk about that. Then there's effective communication, conflict resolution, and record keeping. So understanding these skills are what help you understand what it is that you want and what's possible for you to expect. Next slide, please. So self-awareness is essentially, what am I feeling? What am I thinking? What am I doing? I put the little sticky on here myself because who doesn't love Janice, right? But the bottom line is, don't compromise yourself because you're all that you've got. So self-awareness is important to self-advocacy because we need to be able to understand what it is we're feeling. We need to know what it is we're thinking, and we need to know what it is we're doing in order to decide what that best outcome for us is. Once we know that, then we can start to advocate for that. So how can we assess our own self-awareness? And if you want to put stuff in the chat, or if you want to unmute and give me some ideas, how would you do that? I'm going to tell you. Okay. First, you want to think about the things that you do well. And then you want to think about things that you would like to work on improving. And then what is important? What's important to me? What's important to your client? What is important to that person and why? And then probably one of the biggest things to think about is, do I have triggers? Are there triggers that make me frustrated? Are there triggers that make me angry? Are there triggers that make me impatient? Because those are going to come into play in any self-advocacy situation. So if you do have triggers, think about how you know that's going to happen, right? Do you break into tears when you're angry? Do we angry cry? Or when we're frustrated, do we feel our blood pressure increase? Just to be aware of those triggers is self-awareness. Next slide, please. So as you can see, psychologists define self-awareness as the ability to understand how our actions, thoughts, or emotions do or don't align with our internal standards. I kind of like the Stephen Covey quote a little bit better in this context, because he's reminding us that without our own self-awareness, we're giving all the power away to someone else. So that one to me resonates as it relates to the ability to self-advocate. Next slide, please. It really is the key to self-advocacy. When we're self-aware, we can recognize what those strengths and weaknesses are. And then that recognition helps us to set our goals and make those goals align with our values. Our own self-awareness also helps us to understand what other people's perception is of us. So when it comes down to is, we usually know what we're good at, and we usually know what we need help with, right? That's self-awareness. Next slide, please. The benefits of that are, they give you a better understanding of what you want and or need. You increase your chances of getting those wants or needs met, and it improves your decision making. Without being self-aware, these areas get kind of cloudy. If we're self-aware, we can manage our emotions a little bit better. Go back to that trigger question. And then if we have a strong sense of self, it does lead us to healthier reactions to those external factors. It allows us to boost our productivity and success. It enhances our ability to make our own positive changes, certainly helps our self-esteem, and strengthens relationship with those folks that we're trying to work with. Next slide, please. So just a quick question. How self-aware are you? Do you think that you are extremely self-aware and that you don't miss a thing? That would be option one. Or are you not very tuned in to your actions, emotions, or thoughts? That would be number 4. Or do you fall somewhere in between? Give that some thought for a minute. And if anybody wants to share in the chat where they think they fall, it would be interesting to us. Everybody wants to share? That's okay. That's okay. We can go to the next slide. A 2, self-aware enough to know that I'm not always self-aware, because we're hardwired to lack that trait. That's where I fall as well. Definitely a 3. So a 3 is sometimes, but not always. So according to psychologist Tasha Urich, 95% of us think that we are self-aware, but the reality is only 10 to 15% of us are. Humans tend to be overconfident in their abilities and tend to see themselves in a positive light, or by contrast, we focus on what we see as our shortcomings. How many times has somebody said to you, you don't give yourself enough credit for? Both of those things affect our self-awareness. But once we know that we have room for improvement, that's a first step, right? Once you're aware that you need to be more aware, that's a great first step. Next slide, please. So we've developed this scenario for each one of the skills that we're talking about. So you'll see this scenario: a client's follow-up appointments need to be scheduled on days when transportation is available. And then we're going to ask you to think about what we just talked about and how can we coach the client to be prepared in terms of their self-awareness. So in this case, thinking about what are their needs and what are their strengths in this particular area. How can we coach them to be prepared? Anyone have any ideas? Keep a calendar. Definitely helpful. That's going to come into play a little bit later too, talking about how to use that. Suggest a non-busy day.
I would say, tying back to what you were talking about earlier about triggers, is maybe having clients, I don't know how you coach them, but just be aware of when they might not stand up for themselves because they don't want to bother anyone, or, you know, feel embarrassed that they mixed up the days or something like that. Just feeling confident and that they're worth, standing up for themselves. I don't know.
Absolutely. Schedule 5 more days out. One of the things that we have on here has to do with that. Yeah. Be able to explain the situation that they want to come back for, follow up. But that they want to make sure they have a ride. Okay. Yeah. If you could hit that again, I think it's going to pull up some stuff. Maybe once more. Emma, you threw me with this.
Sorry. I think there's one other bullet point on there. Thank you.
Yeah.
Okay.
So something that we can do is remind them of the rules and the schedules. I know a lot of times my experience has been that they don't remember. They don't remember that it has to be 3 days for Medicaid. They don't remember what the schedules are. But then, always remind them they're the expert on their own life, which kind of gets to what Liz was talking about. No, this might not be a good day for this because, or, and that could be for a multitude of reasons. It could be something going on in their life that day. It could be something that happened on a day like today. It could be something that happened on an anniversary of something. There's 100 reasons why it might not be a good day. So, okay. So I am going to turn it back over to Emma, who's going to talk about effective communication.
Great. If you could change the slide, please. Thank you. So the second core skill that we're going to talk about is effective communication. So this is essentially our way of getting around all of those communication barriers that we talked about earlier. And of course, it is an art and not a science. Effective communication involves presenting ideas, thoughts, knowledge, and information in a way that is understood by the recipient. So it's not about like winning a debate, like winning the conversation, right? We all know people who sort of go into conversations with this mindset of like, I have to win, and that is not necessarily productive. But it's actually really about mutual understanding. It's about both sides knowing what the other one is saying and being able to use that information in a productive way. Effective communication when working with providers can be a challenge. Again, for all of those reasons we talked about before, the many barriers, the lack of time, the sort of sense of differential of power, that sort of thing. So there is an opportunity with effective communication for us as service providers to be a model for how this looks. So the more that we communicate effectively with the people we're working with, the more we're showing them and giving them sort of the patterns for how effective communication can work between a client and a service provider. So it's what they should emulate in their communications, but it's also what they should be expecting and advocating for from other service providers. Next slide, please. Okay, so one strategy for effective communication is to know what questions to ask to gain clarification. And it is important to create a space with your clients where it is always okay to ask questions. I know we are all very busy, and sometimes, a conversation sort of keeps going and going, and going, and you're like, I really got to get back to what I was doing. But we really want to encourage asking questions, making sure that there is mutual understanding between you and the client. So here are some examples of clarifying questions that people can practice in their sort of self-advocacy practicing space. So are you saying, you want me to do this thing, or are you saying you want me to do this thing? Can you repeat what you said to make sure that I understood? Where do I complete this activity? Is it okay if I do this instead? Or, what if this situation happens? So just being comfortable with these questions and developing the confidence and sort of the safe space between you and the client for the client to be able to ask them. Next slide, please. Okay, so one of the most common areas that I think we all, if we have some self-awareness, know that we need to improve is in listening. So we all have a tendency to forget that communication is this two-way process, and improving our listening skills can help improve our communication with our clients and also with clients' providers when we're working on their behalf. Good listeners use the following techniques. So the first one is clarification, which we just talked about in the previous slide. So if you're unsure what someone means, you can just ask them. Another technique is reflection, which is repeating back what you think you heard and then ask if that's what they meant. So it could sound something like, hey, I heard you say that you don't have any appointments available tomorrow. Is that correct? And just making sure that you're on the same page about what you're talking about. And then being aware of body language. So that includes someone's tone and the pitch of their voice, any movements they're making with their body, if they're making eye contact, their posture, their facial expressions, any physiological changes you notice, like sweating or fidgeting. And that can help give you some extra information about where the other person is coming from or how they might be feeling about what it is they're telling you. So take a moment to reflect on your own listening habits. You can choose to share or not share, but do you think that you're a good listener? Just think about it for a minute. Maybe reflect on some communications you've had recently with people. Do you think you're a good listener? And then once you have sort of an answer to that, would other people in your life agree with you? Mm-hmm. Yeah, it's easy to become distracted, especially when you're busy. All right, so once you've had a chance to reflect, what do you think you could do to be a better listener? I know I find that when I'm struggling to focus on what someone's saying, if I just look at them and I stop what I'm doing, maybe I was typing over here while someone was talking to me. If I just stop and I turn my body and I look at the person, it really helps me retain what it is that they're trying to say. Yeah, making eye contact. One thing at a time. Don't think about answering, just hear it. Exactly. And again, like I said before, as you use these techniques and you find the techniques that work for you and you start to use them with your clients, you are also adding to their toolbox because they see you do it, and either consciously or subconsciously, they know that that's what it feels like to be listened to. And then they can start using that in their own life. Yeah, thinking about your response before they're done talking. It's hard not to, right? Because you don't want to drop the thread of the conversation, but it is really important to take in what people are saying as they're saying it. And it's okay to pause if you don't know how to respond right away. Okay, let's move on to the next slide. So now that we've got the listening part of communication down, we're all experts now in listening. Let's talk about speaking. So here are some of the key factors to communicating your ideas out effectively. So you want to be consistent with your verbal and nonverbal communication. So similar to what I was saying before, as you're speaking to someone, if you are speaking to them about something and you want to stay focused, it could be helpful to turn your body towards them to make sure that your nonverbal cues are matching up with what you're saying. Putting together a clear and concise delivery of your message. So this could be if you are calling a provider on a client's behalf, thinking about what you're going to say before you say it, and making sure that what you communicate is concise, clear, and easy to receive. Having knowledge of your topic, knowing who you're speaking to and how you need to tailor that message to be understandable by them, and then being open to feedback. So if people ask you those clarifying questions, not getting defensive about whether or not you're understandable, but responding to those questions and meeting that person where they are, and being open to the feedback that maybe what you explained was not as clear as what you thought it was. Okay, next slide, please. So another important factor is communication style. So we're going to talk about some communication styles and how they might be more or less helpful in a self-advocacy context, because different people have different ways of communicating, and there are different settings in which different communication styles can be effective or not effective. So we're going to talk about the setting of self-advocacy and which communication styles seem to work really well. Next slide. All right, here are 4 communication styles that you may or may not be familiar with. So, and this sort of gets back to self-awareness, right? Our communication style is going to affect how we're received by our clients, as well as the service providers we talk to on a client's behalf. And it's important to recognize that not everyone communicates the same way. So here are 4 common styles. So there's the aggressive communication style. So people who are aggressive communicators, they often speak loudly. They may maintain very intense eye contact. They may control others through blame, intimidation, or criticism. So when I was talking before about people who think about conversations as something that they should be winning, or that there's like a winner or a loser to a discussion, typically that's sort of the aggressive communication style. So in complete contrast to that, the other end of the spectrum is your passive communicators. So they may lack eye contact. They may have a body posture that is turned away from you, and they might not feel that they're able to say no to requests or questions or demands that are being made. The passive aggressive communicator, they might seem passive on the surface, but they might be the kind of person who's going to mutter to themselves as they walk away. So there's sort of an undercurrent of resentment under that passivity. And then the assertive communicators are working on balancing their own rights with the rights of someone else in a conversation. So, there are things that I need, but I recognize that there are things that you need. So I'm going to be clear about what I need as part of my communication style. So a self-advocate's goal, as you can probably guess, is to develop an assertive communication style when speaking with providers. All right, next slide. So here are a bunch of statements that sort of are starting a conversation and thinking about what type of communicators might say these statements. So we're talking about statements like, oh, you never do anything right. Or, yeah, I'm unable to stand up for myself. Or, I don't mean to be rude, or you owe me this. Or, thanks for thinking of me, but I'm going to have to say no this time. How about people never consider my feelings? And, well, if you like it. So all of these, you can sort of see how they fit into some of those aggressive, passive, passive-aggressive. Are there any of them here that strike you as the assertive communication style that we would want to go with? Okay, well, I will give you the answer, which is in this case, the thanks for thinking of me, but I'm going to have to say no this time is, I think, a really good example of understanding, your own needs, right? The answer is no. And understanding the person's needs, which is, you say, thanks for thinking of me, and I'm going to have to say no this time, with the implication that, like, I don't know, maybe next time. You're sort of leaving that open. So that's sort of our example of like the very assertive, we're setting a boundary, but we're not going to be aggressive about it. So there are some downfalls and benefits from each of these forms of communication. I know in a lot of circumstances, like people might find that a passive communication style is what they need to get through the situation that they're in. But in the situation of self-advocacy, we're always going to strive for that assertive, clear communication. So on the next slide, we're returning to our scenario. So again, clients' follow-up appointments need to be scheduled on days where transportation is available. How can we coach the client to be prepared in their communication? Liz, can you click one time? Okay, so effective communication. What needs to be communicated and in what way for this client to get what they need? What ideas do you have? Okay, so at the sort of simplest level, what needs to be communicated is that their appointments need to be scheduled on the days when they have transportation. So Liz, if you click one time. So encourage them to speak up. So if they are assigned an appointment time that does not work for them, this is a situation where you can encourage them to speak up. So Crystal has a really good example in the chat. Thank you, Crystal. It says, I depend on someone else to transport me, so I am happy to talk with you about my scheduled appointment and will definitely follow up if my situation changes. I think that's a great example. All right, Liz, could you click one more time? So another thing that you can do as a mobility management professional when you're working with a client is to practice with them. So if you remind them that they need to talk to their provider about their transportation needs, you can say, hey, if this is not something you're comfortable doing, you can practice with me a couple of times. And if that would be helpful to you, let's just pretend I'm the provider and we will just talk through this scenario and you can get comfortable with those words. And then when you're ready to speak with your provider, you will have the tools that you need to do that. Okay, we are going to move on from the scenario into the third core skill, which Wendy will speak about.
So yeah, we're gonna move on in just a second to conflict resolution, and you're gonna see how self-awareness and effective communication in terms of self-advocacy can come in very handy in a conflict resolution situation. So next slide, please. Conflicts arise all the time, right? I mean, every day something comes up somewhere, somehow. We've all lived it. We've all witnessed it. Conflicts are inevitable in any relationship. So it's really important that we learn how to deal with them respectfully and productively, and particularly when we're talking about the types of situations we're talking about right now. We're talking about those conflicts that arise with clients and providers, not necessarily those that might involve putting the toothpaste top back on. However, some of these tips might come in handy in those situations as well. Okay, next slide, please. This is where you're going to notice some of those communication styles that Emma just talked about. We all know somebody that goes through one or multiple, depending on the situation, styles of conflict. We have the avoider, the one who pretends it didn't happen. And that is probably most prevalent with someone who is a passive type communicator. Okay, then we have the one who gives in. They want to accommodate the other person, but they're not really getting their needs met. So they may also be passive, but there might be an undercurrent of some passive aggressive stuff with that, because it might be one of those, yes, they're going to accommodate, but they're going to walk away muttering something. Okay, so then you get into the standing your ground. This is where you might start to see some self-awareness and some self-advocacy come up, but it's probably going to be in more of an aggressive way. I think Emma said something earlier about debating and winning. This is the person who wants to win. And again, where we want to be is we want to be in a compromising or collaborating situation when we're trying to pursue some self-advocacy. We want to agree to negotiate the larger points, let go of the littler ones, and come to a resolution. And in most cases that we're referring to, we're going to want all parties to be in agreement and to understand. The first two of these, again, they don't really employ those effective communication skills. And again, standing your ground is kind of maybe a little bit aggressive. So the last two are probably the most effective ways to handle conflict in this type of situation. Next slide, please. So in order to reach these areas of compromise and collaboration, we kind of need to know these core skills. So we want to acknowledge the conflict. We don't want to avoid it. We want to identify the issue, not just kind of give into it. We want the parties to meet and discuss the issue. And again, hopefully in a calm situation, not upset and aggressive. And we want to put that solution into play. So in order to resolve that conflict, we really need to go through these steps. And I know it sounds really easy, right? It sounds so easy in these 4 steps. Anybody can do it. And we know it's not. It takes practice. It definitely does. So next slide, please. Try to remain clear and concise. Definitely try to remain in control of your emotions and behavior, and pay attention to those verbal and nonverbal cues. When we talked about those triggers earlier, and I said, how do you identify them? Are you an angry crier? Are you a frustration crier? We definitely want to know what those triggers are so that we can pull it together. And it's perfectly okay if you're in a situation and you're starting to lose your composure to step away and say, just give me a minute. The clear, concise, and calm, that's how you want to approach the conflict. You don't want to go in angry. You don't want to, bring up something that happened 5 years ago. You don't want to bring up somebody else that you worked with. You want to be very clear in what it is that you're addressing, and you want to keep it pertinent to the situation that you're in at the moment. And Emma mentioned earlier too, the verbal and nonverbal cues of others. Certainly that's going to affect how the outcome is going to come out. If somebody's coming at you angry and coming at you or not paying attention, it's going to affect the resolution. So you want to be aware of that, because you might think it's getting resolved and they're walking away with their arms crossed or something. It's probably not, and there's probably going to be more of a conversation to be had. Okay, I saw a bunch of stuff coming up in the chat. I'm sorry I didn't answer all of them when they were coming up. So not sure if there's any specific questions on anything that we've covered so far. If not, we can move on to the scenario for conflict resolution. And if you click once, what issues might arise in the situation where the follow-up appointments need to be scheduled on days when transportation is available? What kind of issues might arise, and how can we react to that? I'm sure this happens quite often. Liz, if you want to click once, it'll bring up one thing. They will likely have to reschedule, or you can brainstorm who maybe in their network. Yeah. Hear their concerns and their about the potential pushback, because we know they get it, right? Appointments are hard to come by, and we know that they're gonna be hearing it. Okay. And then one more, Liz. So the way that you can help them with that is to brainstorm solutions that'll work for them. Kind of like what Crystal said earlier, I depend on somebody else. So, how to have that conversation or just ask them, about a different day or a different time. That sometimes folks are afraid to ask for those things, and they're absolutely entitled to it. All right. So Emma is going to get into the final skill of self-advocacy. So Liz, if you could go to the next slide, Emma's going to take over with record keeping.
All right, so the final self-advocacy skill that we're going to talk about is record keeping. This is a really, really important one. So record keeping means documenting important information about a situation. So that could be phone conversations, it could be written communications, and it also includes face-to-face conversations. So again, it's the act of keeping track of the history of a person's activities by keeping accurate and consistent records. Your own records are often the best documentation of the attempt to resolve the situation. So one of the things that we stress with clients is that you want to have control over your records. That probably means you're going to have to create some yourself. That includes, like I said before, phone conversations, correspondence, and face-to-face meetings. Next slide. So here's an example of record keeping that might go on related to a person who you are taking to a medical appointment. So there's lots of little pieces of information, and in some cases, little pieces of paper that they need to keep track of for this situation. So going into the appointment, there might be medication lists that they're supposed to be bringing. They might have written down information about their own symptoms. Some people keep if they're very self-aware, they keep a symptom tracker, symptom diary. Any test results that have come in since the last appointment, any other information that they want to bring up with the provider. And then leaving an appointment, they should have in hand information about changes to their medications, any diagnoses that they received, any additional test results, and then any referrals that were made by the provider. It's really easy to forget to bring these things, and it's easy to forget to ask for these things. If you are a person who, for example, is seeking care because you're sick or you're in pain, it can be very difficult to remember all of the things that you need. So when we're in stressful or busy or time-limited situations, it's really important to think about this stuff ahead of time. And this is one of those things that you could maybe remind your client as you're picking them up. Hey, do you have everything you need? Hey, did you bring, all the things that the doctor said that they wanted you to bring to this appointment? All right, so here's some more on the next slide. So there's some more information about record keeping related to phone conversations. So this is one that I really wanted to keep in here for you all because you may find yourself on the phone with a provider on the client's behalf, and using skills related to record keeping can really help you keep track of what happened and then help you effectively communicate that back to the client, what happened on that call. So when you're engaged in a phone conversation, you can obviously, so we all work for agencies, we all have our own documentation practices. I'm not going to tell you how to document, but what I can tell you is that it is important to document. So some of the things that we put up on here are sort of across the board. These are general guidelines for record keeping related to a phone call. So date, who you talked to, what was discussed. Sometimes your own sort of personal, sort of subjective opinion of what's going on. Usually that is more useful in your own personal life. So if you're on the phone with your own doctor, you might want to put down hey, I thought they were really helpful today, or hey, I didn't think they were helpful today. And that can help you when you're going back in your notes to sort of put yourself in the frame of mind and remember what it was like to be on that call. If you must make multiple attempts to reach a person, document those. So, you left a voicemail or their phone was not set up, whatever. If the individual is unable to respond to your concerns at the time of your conversation, ask for a date when you can expect a response and record that date. And if you don't hear back at that time, call again. Again, these are all very sort of micro skills, but this is a degree of detail that a lot of people have not been taught. Obviously in service providing professions, many agencies will teach you how to do this, but for the average person, these are not the things you think of to do. Ask for an email address so you can summarize the conversation in writing and send it back to them. That's part of that reflection listening skill. So making sure that you are on the same page by having a written record summary of what it is you talked about. Okay, next slide. So we also included some tips for record keeping for face-to-face meetings. Again, these are all sort of tips that are good for us to know so that we can sort of slowly but surely pass these tips along to the people we're working with. So for example, preparing by knowing what documentation you need and having an agenda of what it is you want to discuss. Maybe you go into your doctor's appointment and there's 3 things you want to talk about today. So you write those down on a piece of paper and you make sure before you leave that appointment that you have dealt with those 3 things. And then always there's the option to take someone with you, not only to support you, but to help keep notes and to help their memory sort of augment your memory in the situation. And having records of what has happened at these different interactions is going to help you as you advocate for yourself so that you can refer back to things that were said. I think there's one more slide on face-to-face meetings. Yeah, so in the realm of record keeping, so you want to document any promises that were made, any actions that you're supposed to take, any explanations given for example, a denial or an approval, document anything supportive that is said. And then if the timeframes for these things come and go, contact the individual that you spoke with and reference the date of the meeting and restate the promises made. That is where the record keeping is important, because then you have that record to back you up as you're advocating. So in the next slide, we're going to return to our scenario one final time. Liz, can you click once? So record keeping. What key information needs to be collected in this scenario where the client's follow-up appointments need to be scheduled on the days where their transportation is available? What do we need to make sure we have a record of? All right, Liz, do you want to click twice? Yep, so needing to know when transportation is available, keeping track of appointment times and communication that was made with transportation providers in case there is some sort of issue. So knowing when pickup is and where you are going. And then I also put here just sort of one of the ways we could be supportive is to just check in at pickup. Hey, do you have everything you need? Yeah, information about mobility aids, because that can change the type of transportation that they need. Yeah, these are great. Okay, Liz, can you go to the next slide? This is sort of just summarizing what we did in this scenario. So to take us back to the beginning of the scenario, clients' follow-up appointments need to be scheduled on days where transportation is available. How are we going through these 4 steps to coach the client? So first off, we're thinking about the client's self-awareness. So what do they need? And we can support them in that by reminding them of the rules that they need to follow for the transportation that they're able to do. So in this case, we gave the example of Medicaid transportation requires 3 days notice where we are. Effective communication. So encouraging them to speak up if they are assigned an appointment time or location that does not fit their transportation needs. And this is something you can practice with them if that would be helpful. So they're calling you, they need to set up an appointment, and you remind them, hey, if they assign you an appointment time that doesn't fall between these hours when the bus is running, it would be helpful if you would tell them that you need an appointment time that fits between these hours. And then, so the way that we can support them in conflict resolution, in most cases, we can't be there right with them as they're experiencing conflict, but what we can do is help them prepare by brainstorming solutions that will work for them. So maybe a different day and time that they can share with their provider if the provider provides some sort of pushback. And then finally, we just talked about record keeping track of those appointment times and communication with the transportation providers in case there is an issue, and then reminding them about taking documents with them and taking notes while they are at their appointment. Okay, next slide. Wendy, I'm going to turn it back over to you.
Okay. So now that we've gone through all those skills, these are some hints that are effective And they're a great place and a great way to start a conversation with the folks that you're serving. Just remind people that they have rights and they have responsibilities, and that it's really incredibly beneficial if they know what those are. Learn and understand the system. Sometimes folks are new to it. They don't know, like in our area, that you have to give 3 days notice. So just, remind them that there are things that they've got to know, and that there's certain things that are pretty hardwired into the system. This one is just kind of my mantra. Don't assume anything and question everything. This is just, it happens all the time. A lot of times those communication errors that Emma talked about earlier are a result of people assuming things and not asking questions. So let them know it's okay to do that. Start a paper trail that goes along with the record keeping, and then don't wait to start. Just jump right in and start to self-advocate. Next slide, please. What situations do you folks think that your clients face that need self-advocacy? Anybody have anything that pops out at them that they see or that they hear? Not us being treated like human beings. I think that's across the board.
I think earlier there was a comment in the chat. So if one leg of the trip is late, maybe the next leg of the trip becomes impossible. And in that case, sometimes the provider will come back to the person. I'm extrapolating from the example that was given, but sometimes the provider will go back to the person and be like, well, why didn't you show up? And the answer is so much more complicated than what the provider is assuming. So that's another scenario. Yeah, everything.
Right. Yep. Yeah. So all of these things, I'm sorry, I just got an unstable internet message, so I'm like, please don't lose me now. All of these things that we've talked about kind of introduce us into the next concept, the final concept we're going to discuss, which is action planning. So if you could go to the next slide, please. We use action planning in a lot of the things that we do around here, a lot of the education opportunities that we offer. We talk about action planning, and the point of it is to break down what seem like undoable tasks into smaller tasks. And it can really help a person plan ahead for an opportunity to take more control of their own next steps. And it also allows them to play an active role in their health outcomes. So you can help them by sharing this concept with folks, encourage them to consider ways to become more empowered. We're going to do an example of an action plan as it relates to mobility management in just a second, but the premise of it is that you want to define the area of concern, and then you want to determine exactly what tasks need to be undertaken to address that concern. And again, we want to break it down into smaller tasks, not some huge, almost undoable type of thing that gets too overwhelming. Is there any documentation needed to perform these tasks? Are there other people out there that can help? And then what would the follow-up strategies be? And finally, what's the expectation of the other side? So if you could go to the next slide, we can see that in action in terms of mobility management. So if you do one click, you want to define your area of concern. So the example that we gave would be the next click. Medicaid covers transportation, but that dastardly form 2015 is required first. Okay. So if we click again, then we determine the tasks to be undertaken that actually address that concern. So if you click once, You want to obtain the form. You want to make sure the provider knows the need of the form. And then one more click. Ensure that the provider submits the form in a timely manner. Okay. So then the next click talks about, is there documentation needed? And we've already said that that form is needed. We probably need fax numbers. Some people still do use fax numbers. There's also online portal access. So then the next click would be, are there the other people who can help? And it would probably be the office staff, maybe you as a mobility manager, or maybe they have a caseworker with a different agency. Okay, so next would be the follow-up strategies. So if the form is rejected, check that medical justification and ask your provider to resubmit. Okay, and then finally, what is the expectation of the other side? And that would be the long-term solution for transportation to appointments. This template can be used for just about anything that you would want it to do. We were doing a totally different kind of program, and somebody said it would be a great template before going to a mechanic. We can adapt it to anything in our lives. The idea is to be prepared and to be organized and to have specific goals in mind. When it's used consistently, the process behind it almost becomes second nature. And you'll apply it to many areas of your life. And the other thing is, if you're doing it, you can see what worked and what didn't. Okay, so if we say, obtain the form, educate the provider, we may find that it's not the provider per se that needs to be educated. It might be somebody else in the office. So we can see what works and what doesn't work so that we can use it in the future. Okay, next slide, please. Anybody want to think of a way that they would use this tool? So for define your area of concern, if you hit the next slide, what is it, or next, yeah, what will you advocate for? What would you use this for? You can think about it, and then we'd go on to the next step. Determine the tasks to be undertaken to address this concern. And again, this can be done anywhere. Is there information that you need? What strengths do you need? What skills, what knowledge, what experience are you bringing to the table? And where would you start? Next. Is there documentation needed? Probably always, right? Everything we do, we need some form of documentation. So have a plan for staying organized and keeping those things handy. And next, are there other people who can help? No matter what we do, we need support. Emma mentioned earlier, taking somebody with you to a doctor's appointment. That could be any of us, right? That doesn't have to just be our clients, but it could be. But that could be any of us. Are there other people? A support system can include anybody, family members, people, organizations. And then follow-up strategies. What will you do if the issue is not resolved? Because we all know that happens too, right? What do we do then? So have a plan so you're not stuck there with just that deer in a headlight look on your face. What do I do next? Okay, and then what is the expectation of the other side? Do you have a goal in mind? Anybody want to share any ideas, either in the chat or on mute? I don't typically get anybody that does, but I thought I would ask. If not, Emma's going to wrap this up.
Okay, so after we have implemented our action plan, again, getting back to that self-awareness skill and sort of exercising that muscle, you have the opportunity to reflect on how that went. So thinking about your action plan and how you implemented it, maybe you write down 2 things that went well about how you approached the situation. Maybe I recognized a trigger and was able to calm myself down before I got angry. Or maybe I feel that I communicated very clearly what I needed, and the person who I spoke to knew exactly what I was talking about. And then reflect on whether there are two things that did not go well. So maybe, it took me 5 minutes to get up the courage to punch a number into a phone because, maybe I get anxious talking on the phone. And I just had to sit there, and it took me some time, and eventually I did it. But maybe in the future, I would want to try and spend a little less time being anxious about the phone and a little bit more time focusing on what I have to do. And then reflect again on how self-aware were you through the process. So in the example I just gave, I knew I was feeling anxious about the phone. And that's good. It's good that I recognized that was happening. And that's a sign of self-awareness. How well did you communicate? Were you passive-aggressive, or assertive in your communication? Did the people that you reached out to respond well to your approach? That's sort of internally you might think, yeah, I was really assertive. But maybe you have some evidence based on the way the person reacted to you that maybe your sense of the situation was a little bit different than what they experienced. So did the person you reached out to, did they respond well to your approach? Does this approach work for you? Would you use this approach again? Did you keep notes and ask for copies of your files? Do you feel like any of your goals were met? Even small ones, even small goals, as Paula talked about in the chat, even small goals within the big goals, with any progress made? And then of course, what would you do differently next time? So this is sort of a practice that if you get into, at first it might feel a little bit unnatural or not necessarily what you would normally do when you're thinking about an interaction. But if you get used to using these steps over time, it will become a little bit more natural and a little bit more just sort of part of what you do when you think about how something went. Okay, next slide. So quick review. These sort of match up with our learning objectives from the beginning. We talked a lot about what self-advocacy is and where it comes from, sort of the history and why it's important. We talked about 4 skills that are key to successful self-advocacy, which are self-awareness, effective communication, conflict resolution, and record keeping. We shared some helpful hints and the action plan as references both for you to use in your life as well as things that you could pass along to your clients, sort of tidbits of information that might help them as they're thinking about advocating for themselves in these situations. So we will be sharing, we'll share the slides, and then I think we can also share, we have sort of a rough outline of the action planning steps that you could fill in. We have a worksheet for that we can share. All right. Next slide. Does anybody have any questions? We have about 15 minutes left, or 10, because I know there's some ending slides from Liz. Any questions or comments, anything that particularly resonated with you that you feel you can bring back to your work? All right, well, if not, Liz, do you want to click to, we have a thank you slide, and we are going to send out a QR code with all of the materials that we have agreed to share. That includes just a super, super short feedback survey. It's, I think, 5 questions, and it's really just, was this useful to you? Was this relevant to you? So that we can continue to improve on this training as we adapt it for different groups. So with that said, on behalf of Wendy and of the Rural Health Network, thank you so, so much for your attention today. And I'm hoping that you all have a really wonderful afternoon. I'll turn it back over to Liz.
Thank you, Emma and Wendy. Thanks so much. You'll actually get another survey when you close Zoom, and ours is really short too, but you can do theirs, and we'll exchange the any information shared, but it's just to help us know if there's anything else you want to know on this topic, or additional webinars you'd like to see on different topics. So it's really just an opportunity for you to help us know what we can do to keep providing information that you need. As Emma alluded to, we do have just a couple other upcoming events we wanted to make sure you're aware of. So next Tuesday at 1 o'clock, there's going to be a tweet chat, although it's X now, so I don't know how my colleague Kara is going to handle that, but it's with a bunch of different partners, and it's addressing inadequate transportation to improve health. So kind of in this vein. And so you can go to our website and, learn more on the peer roundtables and chats page, or, just jump on X/Twitter with the Salud Twos hashtag to join that conversation. And then we're also doing another kind of social media platform called a LinkedIn Learn Along on communication. So something similar to today, where we'll have a couple of videos, and then some moderators from our review board will lead a discussion on that page about applying the videos and the lessons learned to transit. And we also have our conference coming up in the beginning of December, and the early bird registration does end on Tuesday, October 3rd, just for the lowest rate of registration. I'm really excited about all the sessions we're putting together, and there's going to be great, subject matter expert trainers, as well as transit agencies sharing what they do, some really great practices, regulatory information, keynotes. Anyways, check it out. We'll have an updated agenda with more of the breakout sessions and other speaker details, probably early next week. And just let us know if you have any questions, and hope to see you there. And that is it. So really want to thank you all for joining. Again, thank you, Emma and Wendy. And we will be posting the recording and slides on the webinars page of our website. And we can either put any of the other materials that Emma sends there, or we'll just send them out in an email to you all. So thank you again. And always reach out to us if there's something we can do to assist you. And have a great rest of your day. Bye-bye.